Cushing's disease or hyperadrenocorticism causes an increased level of cortisol within the bloodstream. Cortisol is a steroid, and an increased level of steroids cause muscle weakness and muscular atrophy. And that's why they get that pot-bellied appearance. But the same happens to the bladder because those muscles are now weak around the bladder, so the bladder now becomes distended. And with that distended bladder and the weakness and atrophy of the muscles, that means that the bladder will fail to empty with each urination. Now, because they will have some urine just sat there and it fails to empty each time the patient urinates, bacteria can start to grow in that urine. And the high levels of cortisol can make it difficult for white blood cells to enter the bladder in order to break down and combat that bacteria. So the patient can end up with a urinary tract infection. Cortisol is a steroid and it therefore acts as it has some anti-inflammatory properties. So this can often mask the signs of a urinary tract infection, and you will start to see the symptoms of a UTI once the patient starts treatment for Cushing's disease. So if you suspect Cushing's disease in any patient or a patient with PUPD, a urinary sample should be taken via cystocentesis and sent off for full urine analysis, including culture.